COVID cases in the UK are continuing to surge, with latest figures showing an increase of nearly 800,000 in the last week. 1 in 16 people in Scotland were estimated to be infected, and 1 in 19 in England. The autumn vaccination booster programme will now be expanded. Our health correspondent Ashish Joshi has more.
COVID cases are going up again. So what is going on? The latest data from the Office for National Statistics shows almost 3.5 million people in the UK are estimated to have had COVID in the week ending the 6th of July. That's up 29% from the previous week. So let's put that in some context. These are the weekly COVID numbers since last autumn, with the big peaks of the original Omicron variant in January and April, and now the more recent rise driven by variants BA4 and BA5. How is that translating into the number of people getting seriously ill? The number of people dying in hospital within 28 days of a positive test has been increasing since the 1st of June, with hundreds of people dying every week. These figures include patients who have caught COVID in the community or in hospital and were already receiving other treatment. This is highlighted by the number of people needing a mechanical ventilator because of COVID. That number remains stable despite the number of patients going up. These cases are, however, putting a lot of pressure on hospitals, with patients taking up an increasing number of beds and infecting staff. The government's answer? An autumn COVID booster and flu jabs for those over the age of 50, frontline workers, care home staff, and the clinically vulnerable.
Well, here we are in the height of a heat wave, and we've got a peak in COVID cases. Now, that wouldn't be the case for other winter respiratory viruses. COVID will morph eventually into a seasonal winter respiratory virus, but it hasn't done yet. And so I don't think these repeated booster campaigns will happen forever, but they may happen again over the next few months, depending on what the virus does.
The booster announcement takes into account the rise of another variant of concern, BA2.75, first detected in India and growing quickly across Europe. The key will not just be getting people who have never been vaccinated to get jabbed, but in getting all eligible groups to come forward in the same numbers they have done previously.